Hello, my name is Deborah Horner. I'm a consultant in anaesthesia and critical care at Bradford Teaching Hospitals. I'm also the chair of the Yorkshire and Humber Maternal Enhanced and Critical Care Steering Group. I've just been asked today to talk a little bit around MEaCC, which has been running for about the last 10 years across the Yorkshire and Humber region. Just to explain a little bit about what it is, why it's important, and how it fits in with various other projects that are going on both regionally and nationally. So I first became interested in MEaCC when I started working as an anaesthetist with an interest in obstetric anaesthesia. And about 10 years ago, there was a national document which was the first to describe this concept of enhanced maternal care, which was a level of care required to look after women who become unwell during or shortly after pregnancy. What we wanted to do was to look at what the care provision was across Yorkshire and Humber to see where we could support units to improve the care that they were providing and in what ways a regional group would be able to support those changes. We are at a point where we have regional documents now that describe maternal enhanced and critical care and what it is. Those documents have been used to inform national documents for provision of care for sick women. By collaborating with trusts across the region and MDT members from each of those individual trusts, we've identified ways in which we can support those units to improve the care for sick women with the goal of improving outcomes for those women and their babies and their families. But we've also looked at education. How can we better educate our staff to be able to look after these sick women? And essentially that's kind of fallen into two groups. So the initial recognition that somebody's unwell, assessing them in an ABC fashion, and then escalating concerns to others in the team to get help to look after that woman. Now, in the last couple of years, things like the National Maternity Early Warning Score has been introduced, and that fits really nicely alongside that recognition piece, as does Martha's Rule and that idea that families and the women themselves can escalate when they feel that they are becoming unwell to get people there who can provide the care that they need to make them better. The next bit is around enhanced care, which is actually once you recognise you've got a sick woman, how can we look after her better in a maternity environment? And so we have, again, used courses which are available to us nationally. And the course we've been using is Prompt SIP in the main. And that is aimed to educate midwives, more senior midwives, to be able to look after those sick women. Moving on from education, the next step was data. So how many women become unwell? And how do we know that things that we're doing are actually improving care for women? We established the MEaCC database and it started to collect data about 4 or 5 years ago now. And we now have data on about 6,000 women who've received enhanced maternal care or critical care across Yorkshire and Humber, which is a fantastic effort by the staff who are looking after those women, especially given that at the moment that is still manual data entry. When we look at that data, and we have a few publications now which look at this, we can see that this isn't a rare thing, unfortunately. So 1 in 10 women in any maternity unit will become unwell enough to need enhanced maternal care. So that is a really big issue that we need to focus on if we want to improve outcomes for women and their babies. In terms of why women become unwell, the 3 most common reasons are a postpartum hemorrhage, sepsis, and preeclampsia. If we're looking for things that we need to focus on, looking at that alongside providing the kind of care and the training that the midwifery staff need to look after those women, those are the things that we need to start focusing on. And we are going to be imminently introducing a postpartum hemorrhage quality improvement program, which is going to start looking at PPH, because we know from the MEaCC data that's the most common reason for women becoming unwell. And it's about 60% of the women that are within the MEaCC database. Looking at how well we've done from a MEaCC perspective and benchmarking against where we were at the start, we've got fantastic engagement across the region from all of the different maternity units. We've got MEaCC leads identified in all of the trusts, and we've got multidisciplinary leads in most of the trusts. In terms of education, most of the trusts, if not all, have implemented standard competency training. And we're well on the way to most trusts, if not all trusts, implementing the enhanced maternal care competency training. So where next? So I've already talked about the PPH QIP. There's also some other interesting work looking at whether there are groups who are overrepresented within MEaCC. You know that certain things such as gestational diabetes is overrepresented. So there's some work that's going on with that. MEaCC is now hosted within the Improvement Academy in Bradford, and we have lots more information for those of you that are interested in learning a bit more about MEaCC and the work that's going on. So thank you very much for listening. I hope that's given you a bit of a taste of MEaCC. And anyone who wants to contact me by email, I'm more than happy to talk about it again in the future.